guys. I'm Mariah, the founder of Caleigh and Aesthetics, a former educator. I'm your personal cheerleader for all things skin health. So Jen just talked to you guys about hormones. Now I'm going to talk to you about how your hormones can affect your skin and all of that fun stuff. Hormones influence nearly every part of our body, and the skin is no exception. Whether it's puberty, pregnancy, postpartum, perimenopause, or chronic stress, our skin is always responding to hormonal shifts. When our hormones fluctuate, we can see things like oil production spiking or dropping. That can lead to dryness or breakouts. Melanin activity can increase. This is when you can start to see some pigmentation and melasma start coming to the surface. And how the melasma and the pigmentation works, once it's already there, the moment you go in the sun unprotected, it's kind of a trauma response. It again creates more pigmentation to try and prevent the UV rays. Your skin is trying to protect you from being burned by producing excess melanin in that area. It's literally your body protecting you because you're not protecting it. As our hormones start to fluctuate too, our collagen slows down. Collagen is responsible for the nice firming, youthfulness appearance of our skin. As our hormones fluctuate, our skin barrier weakens. This leads to sensitivity, dehydration, and redness. The biggest thing I see is women come into the treatment room and they say that they've never had acne their whole life. They're like, I didn't even have this in high school. Hormones change. Again, we go through pregnancies, go through postpartum, breastfeeding, stress, life changes, traumatic events, all of that can influence your hormones, which then affect your skin. Up to 80% of adult acne in women is directly linked to a hormonal imbalance. After the age of 30, estrogen naturally begins to decline, and with it, our skin loses 30% of our collagen in the first 5 years of menopause. So as soon as you start hitting that menopause rate, not only are you going to start feeling older, but you may start literally looking older. Hormonal imbalances accelerate visible aging by 6 to 10 years if not supported properly. If you are not maintaining your skin and replacing it with essential lipids and things that we're losing as we age, you're going to start noticing that acceleration process. If you go on my Instagram, I have a video talking about how dryness alone can accelerate your aging process. Think of crepey paper. If you put it under light, you're immediately going to see it. That's exactly how dryness works. If your skin is super dry, it's going to look crepey, it's going to look dry. Instead of over-exfoliating or chasing symptoms, I focus on rebuilding the barrier and treating it from the inside out. The way your skin cells work is they're little communicators. Your skin cells are going to communicate with your body and they're going to tell you what's going on. Based on just looking at someone's chin and their cheeks, I know that they probably have a hormonal imbalance going on. Upper cheeks is usually the stomach, pancreas type. So there's all different types. Or simply if I have a teenager with just a bunch on the forehead, it's kind of telling me that their shampoo and their sweat is not combining well. Anywhere that your face is breaking out, there's a story behind it, and your skin is telling you that story that's going on internally. We heal the skin by supporting the acid mantle. I focus on long-term function over short-term fixes. I may have a cute little 75-year-old lady that realizes that she went out with the girls and they told her that she's looking old and she wants to start with the most extreme chemical peel I offer, and that's not going to happen. You can go to med spa if you want that. But by just treating the concern, I'm not doing anything for you if we're not treating the root of the problem. When dealing with acne, instead of just treating the acne, I like to treat the sensitivity first. Acne is inflammation, so we work by calming and soothing the barrier, giving it essential nutrients. For aging clients, we focus on incorporating peptides and oxygen. And for pigmentation, oxygen is another essential nutrient that we need. Everyone needs oxygen, but things like lifestyle, smoking, drinking, if you work outside with a lot of stress, you naturally start to deplete the oxygen. Certain treatments we do, we can kind of infuse it back into the skin. And then this machine right here is new for me, and I wanted to talk about it just briefly because, as I said, hormones can affect pigmentation, acne, anti-aging, all of those things. This machine kind of does all of that.
That's that new fancy one.
Yeah, so this is the Diamond Hydrodermabrasion machine. I'm going to put on gloves so I can touch the tips. Back in the old day, microdermabrasion has been around for about 80 years, but typically it's been kind of outdated for probably the past 25. What it is, it's a bunch of diamonds, and we use them to exfoliate the skin. A lot of the times, depending on how the diamonds were sourced, plays a role in things, the size. And when there's just the diamonds on the outside, you're only ever going through the surface. When there's the diamonds on the inside, you'll always have that kind of contact. As you see, there's multiple different tips. The bigger the tip, the more aggressive it is. So this machine, as you can see, it has a lot of fun things. We'll talk about each. You may be wondering first and foremost what this jar is. This is called a gumpy jar. Everything we extract and exfoliate is going to go in this jar, and at the end of the service, now you'll physically be able to see. Everyone feels their skin looks great after. but to physically see everything we're going on. This is also an educational moment for you to see where you may not be exfoliating fully, etc. The first step of this is obviously I would do my normal double cleanse.
Brings new meaning to diamonds are a girl's best friend.
For the exfoliation part, it's literally just, you'll see right here, it's already starting to look smoother and lighter. This step just goes and removes the dead skin. During your facial, I apply a solution. So between the solution and the suctions, that's where you're getting all of your result. As you can see, it already looks smoother and lighter. This is the exfoliation step. And then once we do that all over your face, we would pause this. We would switch to a hydro tip and then using a different solution. And based on your skin's needs and goals, whether it's acne, anti-aging, or pigmentation, will depend on what solution I use on you. So then we move to this hydro tip. I don't have any fluid on, so I'm not going to do it. But then this goes and does your extractions. And then, as we talked about, oxygen is an essential nutrient. In the past, I had oxygen as a special facial mask. It's not great for everyone's skin types, especially if there is a lot of inflammation. You're going to feel the oxygen entering the skin, and it can kind of create a burn. It's not necessarily like a chemical peel, but your barrier is going to feel that oxygen entering. Think of like dry ice. It's a chemical reaction happening. This is a new method of oxygen infusion that doesn't require the mask. And there's hydrating serums in here so it doesn't hurt. What I would do is I would pick your solution, pour it in this guy, and then directly sprays onto your skin. Think of the nutrients that I'm putting in here is the gas, and then by spraying it directly to the skin, that's putting the gas in the car. And that's delivering the nutrients to your skin directly in direct contact. It's essentially what it is. So between the force of it pushing out and the ingredients is what creates that oxygen infusion.
How often do you recommend this treatment?
It depends on, if we're doing maintenance, it would be about every 6 to 8 weeks. Now, if we're doing it to directly address a concern, I'm most likely going to recommend every 2 to 4 weeks. As soon as it turns blue, that means we're good. I'm going to put a little bit of this. There's no allergies in this. Jen's allergic to everything. Anyone allergic to aloe? Probably not. This is basically just an essential aloe mask. There is spirulina in it. If you've ever been to Gradenberry, spirulina is an essential antioxidant. Most of the things we eat are actually really great for our skin, just depending on how it's derived. I'm just going to put a little bit of this on everyone's hand, and then I'll do the cold therapy on you. A lot of times, estheticians will use straight up ultrasound gel that's very comedogenic. This has skin-loving ingredients in it. That's why I use a treatment mask over an ultrasound gel. And I just got a new mask specifically for redness, rosacea, all of that. And it's a powder and then a gel. And then by mixing it, it becomes active. Typically, when you hurt something, we want to ice it. Ice reduces the inflammation. Cold therapy on the skin can kind of accelerate that microcirculation that starts to decrease as we age. Cold therapy can literally do everything.